Pat and Aaron Show, and it's time for the Injury Report presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And we love football season for many reasons, but one of them is because we get to talk to the many doctors at Florida Orthopaedic Institute and Tampa General Hospital. And this guy right now, I shouldn't even call him a guy, this doctor, this gentleman.
Well, he is a gentleman, but he's also the guy that lets us, I'll call him a guy, right? Because I think it's a good thing, and it's because he lets us call him in the off season, right? Like even when it's not football season, we're calling this guy.
He is Dr. Jeff Sellman. He is the man. Dr. Sellman, how you doing?
What's up? Yeah, this guy. You guys are like the family reunion when you go back and see the creepy uncles once a year, but you're excited for some reason to see them again.
That's exactly right. And you go, this guy. All right, let's speak about this guy, Jordan Love. All right, so he sustains the MCL sprain at the end of the game, and that stinks for Packers fans because it was really literally at the end of the game. Now, the expectation was he's going to miss around 2 weeks, but we're hearing that he might actually give it a go this week. What are the problems that could come up if he does give it a go, Dr. Sellman?
First of all, it's a really good sign head coach came out and said that, which tells us from the medical side sitting on the sidelines that it was not a severe sprain. Very likely just a very small, maybe on the cellular level, inflammation of that particular ligament. But that particular injury can cause a little bit of stiffness in the knee. Going back and forth, in a straight line is actually pretty good and be able to do that. But his position requires pivoting, change of direction, and all that can cause some issues with a pain and maybe a little instability depending on the extent of that particular injury.
And I was going to ask you if, as a doctor, if you've got a young athlete that's coming to you that, plays different positions, if that would at all change when you would suggest a player coming back. And I say that for a couple of reasons, not just about like the pivoting and some of the movement and stuff, but, there's some positions where you can stay a little bit more out of the fray when it comes to contact to your legs, whereas at the quarterback position, you've got guys falling at your legs all the time. What's the level of concern about somebody hitting that joint or that area because of the fact that you play the quarterback position?
I think there's still always a big concern whether or not you actually have that there already laying as an injury, and just giving a little added protection with the brace would be helpful for psychological protection as well.
Let's talk about Antoine Winfield Jr. and keep it local here with the Buccaneers. He was in a walking boot, not a good sign for the Buccaneers. They need him. What do you suspect is going on with Antoine Winfield Jr., and how long realistically do you think he's going to miss from what you've seen?
I think realistically, 1 to 3 weeks, he likely will be out. The walking boot is not always a bad sign. It's actually a really good way to get it to heal. The good news is that if they say that he's likely back in 2 weeks, it's not a high ankle sprain, which involves a lot more tissue damage and a lot more recovery. He might just be plagued with a little bit of instability, a little bit of swelling. I know we've all had ankle injuries before, and these darn things can last, even up to a year with swelling with no pain. So it can be just a little bit weaker.
I remember, when I was younger and I was playing a lot of basketball, I was like banging up my ankle or, twisting my ankle here and there. And there was a lot of days where like I would wake up the next day and for like 2 minutes, I feel like I couldn't walk. And then after that, I was just fine. But also I wasn't trying to be a world-class athlete. Is that something similar to what somebody like Antoine Winfield Jr. might deal with? And what is the level of danger in that situation if they're feeling something like that? Or is it just kind of like part of the process as a human being when you're getting up after dealing with an injury like that?
Oh, yeah, part of the process. What we see a lot is that, like, for instance, like you, when you get a kid as a basketball player, he's at basketball camp, he sprains it on a Saturday, he thinks he's fine, and then gets up on Sunday, he's like, holy cow, this thing is broken. But it actually is not. It's just a part of the healing process. The body comes in with all of this, good stuff to get it to heal, and that creates this amount of swelling that creates significant stiffness. But when you get the blood flow, it just starts to get loosened up again.
Dr. Jeff Sellman joining us right now, Florida Orthopaedic Institute in partnership with Tampa General Hospital. I also want to talk about Bryce Hall, who unfortunately we know he's going to miss the season here. Dislocated right ankle with a fractured fibula against the Commanders. Is that common when you get something like a right ankle dislocation, that something like a fibula could happen as well?
Nearly 100% of the time, if the ankle dislocates, one of the bones is likely going to break, and that's the unfortunate news about it.
Why is that?
When you have multiple tissues involved, like a bone, a ligament, and then a tendon. Each one of those takes a little varying times to heal. If, for instance, he just broke his fibula, he probably would be back within 1 to 2 weeks, depending on what, the break, and they get him in quickly. But when you move that joint out of place, you can even disrupt some of the cartilage inside the joint itself, which just creates kind of a mess for recovery and the athlete itself.
Will he be, next year when he starts to get through the recovery process, will he be able to get back to his former self?
It's going to take at least 6 months, more than likely, after his surgery. And that's just a guess based on just being the fibula involved. But he should be back with no worries about that ankle at all next year. But it's going to take at least 6 months before he's back to contact.
Last week, Jake Ferguson was hurt, injuring his knee against the Browns following a 2-yard reception. He's now considered week to week with an MCL sprain and a bone bruise. When it comes to having that sprain and the bone bruise together, how does that impact recovery? And is that something that you do see a lot, kind of like we were saying with the other injuries being combined?
Especially the way he did it when he planted got tackled kind of weird, and then his whole body weight went down on it, and then you loosen that ligament, and those two bones just come crashing together.
Ouch.
So a bone bruise is kind of like on the spectrum of a break of a bone. So it could take even up to 6 weeks for that bone to feel better, depending on the extent of the contusion itself.
Can you explain that a little bit? Because, like, for me, and I think for a lot of people, you hear bruise and you think, no big deal, because we're used to a flesh bruise, a surface bruise, versus a broken bone sounds like a major thing. Explain a little bit about how they're so similar.
When you have a bruised bone, you get basically microfractures inside the bone. So if there's the lining of the bone that surrounds the entire bone itself, and then all this bony matter on the inside. And with a contusion, you have little tiny microfractures of inside the bone itself. So not only do you have to get that blood to drain away, but you also have to reorganize that bony tissue, which takes a little bit. And it's the same thing as for a fracture. It has to be reorganized and built into new bone.
Zyon McCollum, last one here, and I know I didn't send this your way, but is dealing with a concussion, and he was in a non-contact jersey. He was practicing yesterday. He dealt with his concussion days ago. How do you know, what are the stages, Dr. Sellman, of getting a guy ready to go after a concussion and knowing that he can get through protocol without the symptoms?
Yeah, that is the biggest question. It's still really reliant upon subjective data from the actual athlete themselves telling us what they feel, so being honest with what their feelings are. Now, we have different kinds of tools such as computerized testing, these balance testing, that we use objective data to have and compare to what he was before he had the injury. And when those get back to where they were before, then we're pretty confident that, okay, let's move them on to the next step.
Oh, and real fast here, somebody texted in, and we like to get to the text messages because they like to get involved here. I don't know if you've been paying attention with Christian McCaffrey. It's been weird. We heard he missed game 1 because of the calf, and now we're hearing he's going to miss game 2. The Achilles potentially as well. What do you have concern there long term with him?
The Achilles is attached to the calf, so it has no surprise that now they're coming out with the Achilles. The Achilles is such a high tension tendon that when it even gets a little inflamed, boy, does it really interfere and affect your gait, your run, and everything. So going forward, that could be a little bit of an issue.
Dr. Sellman, he knocks them all out of the park. We always love having him on, and we're definitely going to be having him on as a regular throughout this season with our injury reports. The Pat and Aaron Show Injury Report, presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. So if you're dealing with one of these injuries, if you felt this before, if you know somebody who's dealing with it, make sure you check out Florida Orthopedic Institute and schedule that appointment today at floridaortho.com. Dr. Sellman, we love you, and we'll talk to you soon.
Thanks, Doc.
Love you guys.
That's
He's the
great.
best.
He
He's
is
the best.
fantastic.
Love having him back.